Good morning and thank you for joining us. We are joined today by our elected officials. We will begin with Mayor Christine Lumbergh from Springfield, followed by Mayor Vinnis from Eugene, and finally Commissioner Heather Buck, Chair of Board of County Commissioners. So we'll begin with Mayor Lumbergh.
Thank you. Today we want to acknowledge some of the questions we're hearing from our community as state efforts to reopen Oregon become more shaped and defined. Some businesses want to know when they can reopen. It's on the minds of many business owners and workers as this pandemic is hitting the economy hard. A recent survey by Business Oregon, Travel Oregon, and the Small Business Development Center found that of the 5,000 businesses statewide who took the survey, 72% reported a decrease in sales. 40% reported a decrease in hours for workers. We are going to reopen. Restrictions will ease. We also know it will take time and be a phased approach. The state's guidelines, along with Lane County's blueprints, will provide us with a better understanding of considerations businesses must take before they reopen. Some businesses will be in a position to reopen as soon as allowed. Others may need more time or support. We are here for you. We will continue to advocate for your needs and support you where possible. The process of reopening will be imperfect, but our goal is to do the work in partnership with you. Another question we're hearing is, when can we access recreation sites such as parks? Just this week, it was announced that some state parks would reopen and day use will slowly return at several state parks starting May 11th. Many parks in our area are open, though playgrounds and facilities remain closed. Check online before going to your favorite place to recreate. And remember, even as restrictions ease, we must follow best health practices to reduce the spread of illness. While this pandemic has changed our worlds, it has also solidified just how important community really is. Our focus is getting people back to work and to activities they enjoy, and keeping people safe. We have to work together to do this. Thank you. And now I'll welcome Eugene Mayor Lucy Vinnis.
Good morning. Thank you, Mayor Lumbergh, for those important reminders. As we begin to learn what reopening looks like for our area, it's important to remember that we are not immediately returning to a pre-COVID-19 normal. Face masks and physical distancing will continue to be a part of our lives. One question we hear from the community is why we aren't requiring people to wear face masks in all public places. In alignment with recommendations from the CDC, we are asking everyone to wear a cloth face mask in public settings where they can't maintain that critical 6 feet of physical distancing, especially in places we all need to go, like grocery stores and pharmacies. Face masks capture droplets leaving your nose and mouth, significantly reducing how far those droplets can spread and protecting those around you if you are carrying a virus. This is important because we know there are many people who never show any symptoms of COVID-19, even though they have contracted the virus. Physical distancing will remain an important way for us to protect the community, as well as continuing to wash and sanitize our hands. We do not know how long this virus will be in our community, but we do know that maintaining physical distance reduces the chances of transferring COVID-19. Once again, I'd like to thank the community for working through this together and continuing to protect your neighbors, friends, and family by wearing masks and maintaining physical distance when outside of your homes. And now I'd like to introduce Commissioner Heather Buck.
Good morning, everybody. My name is Heather Buck, Chair of the Lane County Board of Commissioners. Another question we hear regularly at Lane County is, how can I get tested? Last week, the Oregon Health Authority updated their testing guidelines and widened the criteria for testing. Previously, only those who had a fever, lower respiratory symptoms, or who were very, very ill were allowed to get testing. While that helped inform care for very sick people, it didn't tell us the widespread disease as what we now see throughout the state and locally here in Lane County. Now we're being encouraged to test people who may not have a cough or fever but show some other more mild symptoms associated with COVID, like chills, muscle pains, headache, sore throat, or a loss of taste or smell. We're also encouraged to increase testing of people who are in higher risk categories, such as the unhoused and assisting living centers. The widening of the criteria is a direct result of increased testing capacity in Oregon and locally through the partnerships between hospitals, public labs, and private labs. If you or a loved one are experiencing symptoms of COVID-19, we encourage you to contact your medical provider and inquire about testing. Tests must still be ordered through a medical provider, and all doctors in Lane County have the ability to order tests for patients that meet the criteria. No testing is where it needs to be yet, nor where we want it to be. But these increases are helping us gain a better understanding of the disease in our community and help us move toward a reopening more quickly. Additionally, the increased testing capacity at Lane County Public Health to more thoroughly investigate our potential cases and those who may have come into even brief contact with a symptomatic person are available. And finally, the question that has been asked the most in recent days, and for me in the last few weeks, when will Lane County reopen? On Tuesday, the Board of County Commissioners voted unanimously to support the blueprint for Lane County to begin the reopening process as soon as the governor allows counties to petition for phase 1. Based on the most recent information from Governor Brown's office and a conversation I had with her on Tuesday afternoon, tomorrow we expect to be able to submit our application for phase 1 so that we could begin as early as May 15th with state approval. I'm going to go through the phases a little bit here. Some may sound very familiar to what I mentioned last week, with one key difference. The first phase of our plan would allow for very small social gatherings and limited reopening of some businesses, the ones that are better positioned to maintain physical distance for their customers and their employees. Phase 2 could start 21 days after phase 1. That's the key difference. In the conversation with the governor this week, the first phase and possibly into the second phase will be 21 days rather than previously expected at 14 days. So phase 2 would start 21 days after phase 1. We would be able to expand the number of people allowed to gather in groups, allow non-essential travel, and widen the types of businesses that would be allowed to resume services. Phase 3 which we could start 21 days after phase 2, would be our new normal for several weeks, possibly through the summer, and would allow an increase in the gatherings, unrestricted staffing at work sites, and visitors to assisted living facilities again, and increased seating in bars and restaurants. Progressing through the phases is dependent upon Lane County continuing to show decreases in cases for at least 14 days, enough personal protective equipment for our medical professionals, and that we can test enough people to track the disease. While it feels wonderful to plan for the return for more normal living, it's important to remember that parts of the plan the governor may change, and that may require changes to our plan here in Lane County. I encourage you to view our blueprint online at www.lanecountyor.gov/blueprint. And with that, I'll pass it back to Jason.
Thank you, Commissioner Buck, and thank you to our two mayors. One thing I'd like to reiterate that they definitely touched on, and I think is one of the most important messages that we have to deliver right now, is that, our Board of County Commissioners has really heard our community and about the struggles that they're facing under being closed down. Many businesses are struggling right now. Individuals are struggling financially, and they've worked to make that recommendation and that application available to our governor. When we are approved is really up to the governor's office. And so we're advocating for you. We're working hard to make sure that we are ready to begin that process. However, the timeline will really be up to the governor's office as we submit those materials. And so we want our folks to understand that. And also, as we begin that process, and Commissioner Buck just touched on this, so it almost feels redundant to bring it up, but it's worth mentioning again that throughout the entire process, we have to maintain that steady declining of cases. If we start to see a spike again, then we'll be forced to report that, and then also to consider that as an indicator that perhaps what we're doing is not working. And so really, part of this whole process is making sure that we are all personally accountable to some of those safety measures. Really easy things like keeping space between ourselves and others, wearing our mask when we're in public places, and making sure that we're practicing good respiratory hygiene. And so with that, I'd like to start by giving you a brief case update. We currently have 57 positive cases, so one more than yesterday and two more since the last time we spoke to you. We will now be reporting presumptive cases, and again, the definition of what a presumptive case is an individual who has had close contact, 6 feet or less, for at least 15 minutes with a known case and is displaying symptoms. Currently, we don't have any presumptive cases to report out. So as we start to get those numbers in, we will report those as well. We have 11 individuals who are under monitoring. So these are individuals who have had that close contact but do not have symptoms. So they're not a presumptive case, but we are monitoring them. We're asking them to stay home for 14 days. We're checking in with them twice a day to monitor for fever and other symptoms, and then we can also begin the process of getting them tested as well. So just want to give you an idea of how many individuals we're currently monitoring right now. We have at least 4,843 tests coming from our area, our county, to our local labs. And I am also happy to report something that I've touched on in other press conferences, that the majority of our tests really are being done here in Lane County, with just a few exceptions going up to the state public health and other outside labs. So that testing capacity is really becoming a reality. We had nearly 300 tests administered yesterday, which is fantastic news. We are still getting reports from people that they are not able to be tested, or that their provider has declined to allow allow that test, and that's something that we're working on, really trying to get that message out to providers that yes, if you have a patient who is displaying mild symptoms, they can be tested and they should be tested. We have that capacity here. So we will continue to reiterate that message directly to your providers, and we hope that that situation changes very soon for those individuals. Of our confirmed cases, we have nobody hospitalized. We have 42 individuals who have recovered, so well on our way to a full recovered number. We are still at 2 deaths and 13 individuals at home recovering from COVID-19. I would also like to share with you the fact that we have established an epidemiological link with case 56 to another known case. And so really what that means is that individual, we were able through contact tracing to identify how they got sick, where they got sick from, and then we work backwards from there. And that's how we get those presumptive cases, and that's how we get those people who are under monitoring. And overall, that whole process is what will protect us as we begin to reopen, understanding that we will move from broad stay-at-home orders to individualized stay-at-home orders, and really hopefully be able to contain the disease through that contact tracing. We also continue to see a disproportionate number of our new cases identifying as Latinx individuals. This is something that we've seen a trend on throughout the outbreak, and something that greatly concerns Lane County, and that we've been working actively with our partners to try to make sure that that message is heard to folks, so that they understand how to prevent this disease and what they can do to help keep their families and themselves safe. Another piece of exciting news, the state announced that they will be releasing numbers and data by zip code. This is something that we heard loud and clear from our rural residents, that they would like to be aware of whether or not COVID is in their areas. And so we echoed that message to our state partners and really made sure they heard that. We believe that that was part of the consideration, and they've done their best to try to make this data available without compromising individual identities. We took that one step further to make sure that as we announce cases, we can keep confidentiality. That's why as we announce new cases, we're only announcing the age and not the sex of the individual, and then the approximate location. But also having this map right here, it's a map of Lane County with the individual zip codes broken down. And you can see 97402 and 97405 are the two zip codes that have the highest numbers at 16 and 10 respectively. So that is available on our website. We won't be calling out individual cases by zip code, but you can always go to our website starting today and access that information. We should have this up probably sometime by the end of the day. So if you don't see it when you first log on, be patient. We're trying to work out some HTML kinks most likely. Also, that's going to be new on our website, and you probably will not be able to see this. I was talking to one of my other PIOs, and they said, you know that this is going to be a blank sheet of paper on camera. And so understanding that, hopefully you can still make out something. You'll see several tables here. This is basically our 7 points of consideration for reopening. And what it does is it allows people to track how we're doing. So we have individual numbers here. Also, we have the designation of whether we're green. Green means go, we're ready to reopen. Yellow means caution, that we still have some work to do, but we're in a good place. And then red, obviously, we have a lot of work to do. And so that will be also available in the next couple days on our website for folks to be able to track in real time. Another message, I was on the phone yesterday with some partners from our local hospitals, Peace Health and Mackenzie-Willamette, and they really echoed the message that we need people to start coming back to the hospitals. If you have a procedure or a condition that requires either hospitalization or to be seen within the hospital setting, that now is a safe time to go visit your hospitals. Our hospitals have been very diligent about making sure that they pursue all safety measures available, including dividing up their hospitals to COVID and non-COVID patients. So they do those screenings when you first walk in and then divide folks up. And those screenings include a number of different health indicators, which they would be able to get a good idea about whether or not you are a COVID patient or non-COVID patient. Additionally, they require mask usage within the hospitals. They do frequent and thorough cleanings throughout all the facilities. Visitors are restricted, so there's a number of different protocols which they've followed that really we as public health believe that those hospital settings are a safe place to go get care. And our hospital's ability to stay open and to maintain the services and staffing that they do require folks to go in and get those services. So please do feel safe to go in and utilize our local hospitals. Another message that we'd just like to get out to folks is that you're going to see a shift in messaging very soon, where there's going to be much more talk about the recovery piece and looking at explaining some of the guidance that we will receive from the governor's office. So a couple points on that. One is, our guidance is really going to be reflective of the governor's office and the guidance that they issue on the different phases. And so we will be following that. And it's going to be changing. And we heard Commissioner Buck mention that. So please be patient. Please stay up to date. If you are a business, some of the things you can be doing is look at some of those draft guidance that have been made available through media and look at some of the different spacing requirements that they have listed in there. Those we feel like will be reflected in some way in the finalized plans. And so that's something you can do right now, is getting prepared to be able to lay out your business in the way that will help you reopen. But just be aware that we will be following that advice from the governor's office and the blueprint that she has within her phases. Once that is finalized, it'll be on the state's website. We will also list it on our COVID-19 website under the business information tab. So feel free to visit there for more guidance as we will make it available. Also, you've heard some talk about state parks and some state parks opening day use areas starting potentially tomorrow and through the weekend. We'd like you to know that Lane County day use areas have remained in large part open during the outbreak, and that's not going to change. We are not changing the status of Lane County parks. This is really just for state parks. But that information is going to be made available, which state park day uses are going to be opening up. So please look to the state parks website. And before you go anywhere, I believe, again, Commissioner Buck mentioned that, but it's worth repeating. Also, just one, definitely not the least of the most important things out there, because they've been such a great asset for us. Our ASL Interpreters, yesterday was National ASL Interpreter Appreciation Day. So I would just like to personally appreciate LaDonna and her ability to make sense of my ramblings and fast talking as we have gone through this outbreak. She has done a tremendous job, and so has the company who she works for, All Hands Interpreting. We're very appreciative of them and the service they provide to those in our community who are hard of hearing. So thank you to LaDonna and all ASL interpreters. And last but certainly not least, I just want to drive the message home. Please do get tested if you have mild symptoms. This will help public health understand the boots on the ground situation here in Lane County. It will give you some personal peace of mind, and we have the capacity to do so. So please do ask your provider about getting tested. And with that, I will take any questions from members of the media.
Two from Sam at KEPW.
Okay.
The first is there an adequate enough testing supply, including reagents, for the average citizen to obtain testing locally?
So these questions come from KEPW Radio here in Eugene, and they would like to know, is there adequate supply of the various components of testing to be able to make testing available to the average individual here in Lane County? So that is a loaded question. There still are national shortages of some of those supplies. However, we do feel confident that we have, through our partners, some supply chains that are, at least for the interim period of time, reliable. And what we're doing right now is opening up testing to individuals with mild symptoms. So no, we are not saying that testing is available to everyone or that anyone can get a test. That's not true. What we're saying is that individuals who have mild COVID symptoms can now talk to their provider, and their provider can recommend them getting a test. You still need that note from your doctor, that prescription, so to speak, to get tested, and they will really evaluate you. And again, your provider knows you. Hopefully you have that relationship with them where they're able to look at your symptoms and say, I really believe strongly this is seasonal allergies. And that's what they're there for. They're there to make those assessments. So we do have faith in our providers to make those assessments. I think the piece that we're really trying to hit on is helping our providers understand that we have enough supply to be able to test those individuals with mild symptoms.
Where does public health stand on the future of the respite centers after reopening weekend?
So the next question from KEPW is where does Lane County stand on the status of the respite centers, those facilities that we opened up to be able to help our unhoused community meet the governor's stay-at-home orders, understanding that it's hard to stay home if you don't have a home. And so what we're doing right now is planning for the future of those respite shelters and how we move through making sure that all of our decisions are data-based and that we're making sure that we're doing the right thing at the right time. So that's currently in planning. We don't have any firm dates or firm plans right yet, but we've been working on that for last several weeks, and really was part of our thinking when we opened the respite shelters is saying, okay, we understood that this was a temporary solution. This is not a permanent solution to homelessness. So we have to have a demobilization plan, but we also understand that we can't just pull the rug out of individuals once we've provided a place to stay for them. So it's going to be a complex and lengthy procedure, but we are currently working on that.
Questions from Michael at KECI. Has the Sentinel testing program been fully rolled out at the temporary respite shelters yet?
So a question from Michael Severin at KEZI. Has the Sentinel testing program been fully rolled out at the respite centers? Yes, Michael, it is happening this week. And so I believe that we have, I believe it's between 80 and 90. I will have to fact check that. Individuals tested from those facilities. And we are also this week extending beyond just our respite centers to some other unhoused facilities here in Lane County. So that is our priority this week. And then next week, we are moving into assisted living and long-term care facilities. And finally, the plan is by the week after next to look at broad testing within our Latinx population.
Carrington Powell from the Daily Emerald. What systems does the county have in place to make sure the people who are in quarantine are able to get their needs met? Will we deliver groceries, for example? This is tied to the contact tracing.
So a question from the Daily Emerald. They said, what systems protocols are in place? So as you go through contact tracing, you identify individuals who need to be quarantined, who need to stay home for 14 days. What systems do you have in place to make sure that they have what they need? And so that's a really great question. That's a part of what contact tracing does. So we're not just gathering information. We have our public health nurses who are doing that piece of it and really trying to get down at tracking the disease. But as we start making those recommendations to stay home, we have community service workers who work with the individuals and ask, you know, what do you need? What is your current situation? What is your housing status? What is your grocery status? Do you have loved ones who can help deliver supplies to your home? And if they don't, that's something that we work to help provide. You know, in a much smaller capacity way, if we have a TB patient or a measles patient that needs to be quarantined or isolated, we do this work year round, where we sometimes even provide entertainment or groceries or you know, what have you. Anything that you would need during a typical day, we try to make available to these individuals, understanding that much of this process is voluntary. And so really what we want to do is we want to make the healthy choice the easy choice. And so that's all part of that process and something that we actively do.
Question from Fema at KCI. Do we have to apply for each phase of reopening, or does it happen naturally after 21 days if cases continue to decrease?
So the question is from Emma at KZI. Do we have to reapply after every phase of reopening? Or will it just be assumed that we move on to the next one? So my understanding, Emma, and I don't think that we have clear guidance on all those different components, but I will say that my understanding is that throughout all the phases, we have to be monitoring our situation and watching and ready to either lengthen that phase or to go back potentially to some more restrictions. So that again is why it's so important that we take on the personal responsibility part of what the restrictions really aim to do. So looking at your own life and saying, do I need to go to the store today, or can I go to the store tomorrow and then last for the rest of the week, and trying to minimize your travel, trying to minimize the number of gatherings you have, trying to make sure that some of the great habits that we've all developed throughout this outbreak, like washing your hands and covering your cough or sneeze, are continued. That, you know, the newfound freedoms that come through some of the restrictions being lifted really don't take away the importance of some of those what we call non-pharmaceutical interventions.
The last question is actually for the mayors.
All righty. The last question's for the mayors, and I will turn it over to them.
So Mayor Venice, question from KEZI. Congressman DeFazio is pushing for stimulus money to help cities pay for essential services. Does Eugene need financial assistance? How has COVID impacted the budget? And we'll ask the same question to Mayor Lambert next.
I will just answer this briefly that we have a budget committee meeting on May 13th, so this coming Wednesday, and the council and the public will have our first opportunity to look at the impacts to the budget and the city manager's proposals for how to move forward. So that, our first concern is going to be making sure that our first responders are supported and that we are able to maintain other city services. So encourage people to go to the City of Eugene website where you can actually watch that budget committee meeting.
So I'll address first the impacts to the budget. Our budget committee met on Tuesday night. The budget currently is a status quo budget for Springfield. The budget committee will be meeting again next week with the same idea that we are going to move forward with the status quo budget. And then over time, we'll monitor the impacts that are coming in. So the budget will be adjusted probably later in the year, but right now it's status quo. But I do want to say that the kind of things that we are going to need help with, and particularly, as Mayor Venice said, is to make sure that our first responders have adequate funding to continue doing all of the work that they're doing. So we're very keen on watching out for that. And also the other piece that particularly Congressman DeFazio can impact is our infrastructure, which we have many projects that we need to do, and infrastructure has been a problem for quite a while. We also are meeting with LOC. I'm on their board, and we're working with them at the state level to make sure that all of our needs within the state are taken care of. And the other piece that we want to make sure we would love to have happen is that we have a 100% Fema reimbursement that I know that Congressman DeFazio is working on. So I want to thank him for the work he's doing on that. And if there is another package that comes out of the federal government, some of the talk is that it'll be around housing, and that would be a great place to put dollars, is to make sure that people maintain their housing and we keep people as stable as possible. So there's lots of places the federal government can assist us now, and we'll be working to make sure that we're advocating in Springfield for those things to happen. Thank you.